Dr. Norman Swan, you always have some way of making us understand this a little bit better, but what's your take on the stage 4 lockdown? Is it going to work?
Well, if I could prophetize the way you hope that I can, I'd be getting a Nobel Prize, Lisa. Look, it's the only thing that's going to work. We've said that week after week on News Breakfast, that when contact tracing starts to be overwhelmed, and it is, the ability to find out where everybody got their virus from. What we said last week has come true, which is that the key statistic to look for is the number of people who have got unknown source of infection. And that's when you know that you don't know where the virus is in Victoria. And that means you've got to stop asymptomatic, people with mild symptoms, people who are not coming forward for testing. You've got to isolate them, stop them coming in contact with other people so that the virus disappears from their bodies. And if this lockdown is severe enough, and it probably is, but we wait to see, then the virus, and it takes up to 9, 10, 11 days after symptoms appear to disappear, you would expect quite a dramatic reduction in infections over the next 2 weeks, even though you've started from a high point. New Zealand started their extreme lockdown at 90 cases a day. Victoria is starting at anywhere between 450 and 700 a day. And that's a big mountain to come off when there's a lot of people with unknown source. But basically, if you isolate people and they don't come in contact with them, the virus will disappear from their bodies and they will become non-infectious.
Now, you had an interesting piece on 7:30 last night where you had exclusive access, Norman, to the Burnett Institute study on how effective stage 3 was and casting forward to stage 4. And also there's a debate, isn't there, about whether the government is getting the message across, whether the punitive talk, the talk about penalties and fines is the best way to go, or whether, I guess, the strategy needs to be a bit more nuanced.
Yes. So first of all, they've done modelling in July and showed, and this gives you hope for stage 4, is that stage 3 actually worked quite well. It just didn't work well enough. They bent the curve down. So when at the beginning of July, 10 people were infecting 17 or 18 other people. At the end of July, 10 people were infecting 11 or 12 other people. So that's, that's a pretty good. And that means 20,000 people, 20,000 Victorians weren't infected with the coronavirus who otherwise would have. On the day where it was 700 cases, there would have been 3,000 or 4,000 that day. So that's been really a dramatic shift, but it's not halted the virus's spread. And we all know there are serious problems with outbreaks. The other thing here is that Victoria's taken a pretty punitive approach, and a lot of Victorians would be sympathetic with that, and you can understand that you need the stick as well. But the evidence is that punitive approaches don't necessarily work very well. They didn't work actually that well under stage 3. 1 in 4 people weren't there when the army turned up and knocked on your door. And so the question is, have we actually buried into communities and got communities to take ownership of this? And there's a huge number of diverse communities in Victoria. This is a serious issue. Now, the poster child for this are Aboriginal communities in Australia. There's been no COVID-19 effectively in Aboriginal communities. Why? Because the Commonwealth had the sense early on to give control of this to Aboriginal communities and Aboriginal organisations, and they took control of the messaging. And they've had challenges at times, no question about that, but getting into those communities and giving communities responsibility and control of the messaging, nuancing the messaging. We've almost got no sophisticated advertising campaigns. We've got some of the best advertising people in the world in Australia, and we're not seeing interesting, targeted creatives which are going to move young people and others, and using role models, all sorts of things. That's what we've got to do now, and we've got to do it in the rest of Australia as well.
Norman, the other story we've been reporting on this morning coming out from the WHO, the chief there saying there may not be a silver bullet. What happens if there is no vaccine?
This is the conversation I think that Australia has to have. We are behaving, and governments are behaving, in the hope, you can just see it in their eyes, in the hope that there will be a vaccine sometime in the next 6 to 12 months. And there is no guarantee of that. We all hope. There's some very promising results, but there may not be. It's not an easy bug to actually get a vaccine to. So what if there's not? And having that conversation. So let's just take Victorians for the moment. Victorians are now going into extreme lockdown. People are losing their jobs, businesses are closing. What's the payoff for that? Do you think Victorians are going to be happy if the payoff is 12 cases a day, such as you've got in New South Wales? I think you'll find that most people want 0 cases a day, wherever they are in Australia. But is that sustainable? What are we prepared to tolerate? I don't have the answers, but I think we need that national conversation, how much risk we're prepared to tolerate, and how the relaxing borders and what have you, and also research into treatments. We are tending to focus very strongly on vaccines, and really we need to be spending a lot of money on viral treatments, because if we got an effective treatment, that would be game over as well.
Norman, if people want to hear more, they can listen to your CoronaCast podcast and RN Health Report. Thank you for joining us this morning.
Always a pleasure.